Welcome to another Beauty Fitness podcast. I am your host, Brian, and I'm here with my co-host, Beth. Today, we are going to jump right into it. Today's guest, let me get there. Okay, today's podcast, we're talking to non-surgical neck and back specialist, integrative diagnosis provider, board-certified doctor of chiropractic, Dr. Brian Zelasko. Brian, thank you for joining us today.
Thank you for having me today.
That is a mouthful. That was a lot.
It really was. Because honestly, I can't even say enough about Dr. Z. And
I'm just going to let Beth go. I'm just going to sit back.
And it took me a long time to decide to let this one happen, right? And I was really like thinking, Brian's my hidden gem. Like nobody knows about him. Yeah, guess what? I was wrong. I was late to the party. I had a friend of mine, Amy, tell me about Dr. Z. She was a nutrition client of mine from a couple years ago. And she knew the story. You know, my daughter's a gymnast, and she was constantly looking for a way to help her with recovery, you know, being a competitive gymnast, and she was 3 years old. Her body's really taken a beating. And we had, so many people like, well, other doctors. Well, you should just stop what you're doing. You should just stop, and it was a totally different story when we went to see Brian. And we'll get to that part of it too, when we talk about the myths and misconceptions. But so apparently I'm late to the party, and everybody that I know loves Dr. Z. So welcome everybody to the world of Dr. Z. You will love it. Go ahead, Brian. I'll let you take it away.
That's so awesome. Brian, can you give people a little bit of background about yourself?
Sure. A local of Western New York. I was born and raised West Seneca Orchard Park. Grew up, graduated Orchard Park High School, went on to play baseball and do kinesiology at the University of Buffalo. Decided from there to pursue chiropractic college, and wasn't really sure if that was what I was going to stick it out with or not. Had a discussion with my father actually at one point, and he was like, well, go for the first semester and find out how it goes. If it's, off the wall, we'll bail out and figure something else out. At that point, I had my strength and conditioning certification and my kinesiology 4-year degree, so I had something to fall back on. But I got in with the right group of people in school that first semester, found out about some soft tissue related techniques that was currently doing for a couple of years when I got out, and then it progressed from there. So it's just kind of found my way. I did not go through high school or through college saying I'm going to be a chiropractor or a doctor of any kind or anything of that nature. It was just kind of year to year, kind of figuring my way out. I had originally gone into undergrad thinking physical therapy, and had done my own physical therapy with a sophomore year injury to my shoulder, and realized that wasn't exactly what I wanted to do. For various reasons. And I was in a sports clinic there when I was doing my rehab, and I was just like, maybe this isn't what I want to do. And I really enjoyed the strength and conditioning side of it. I know Brian and we've had discussions about that in the past and whatnot. Mm-hmm. And that's where my avenue was going. That's where the road was taking me once I got out of my undergrad and whatnot, and going to chiropractic college was just kind of on a whim to check it out and see how to further my education.
So you were an athlete growing
Correct.
up.
Yeah. I played baseball at the University of Buffalo. I was there for 5 years. I redshirted as a sophomore because I had shoulder surgery in the middle of so I had to try to come back from that. Never was really the same, but fought through it, still played for 5 years, for another 3 years after that. Really enjoyed every minute of it. And then, as any athlete does, to figure out what you're going to do after that when that ends. I took a semester off. I got accepted into chiropractic college. I started school January of 2005, and then kind of took it from there for the most part. So when I got done with school, decided to stick around the Western New York area. Had thoughts of traveling out west, going out to Colorado or whatnot, but never made the move. Just figured it'd be easier to get, started on my own 2 feet here.
Right.
And it's been really good. So.
What majors, you said that first year you were going into chiropractic, what other majors were you testing the waters with if it wasn't chiropractic? I know you're talking about PT, but was there anything else, or?
In undergrad, it was physical therapy. It was from the get-go. And then in my sophomore year, decided that wasn't quite for me. hindsight's 2020, because as of this time right now, what I do in my office to treat patients, I could easily be a physical therapist by degree and still do the same thing.
Mhm.
So it's just how it ended up being. But to answer your question, I was going more down the strength and conditioning road. My strength and conditioning coach in undergrad was a mentor of mine, learned a ton from him, still pull a ton from what he taught me going through undergrad and going through the strength programs with him. And so I thought I was going to go down that road. And then my father worked for himself. He was a dentist in the area for 35, 40 years, I forget. But he worked for himself. I saw that side of things, really liked that avenue. And at one point thought I was just going to have my own personal training gym of some kind and go down that road. And then got caught up going to school longer.
I think it's the circles we run in, Brian, because I think everybody around our age
Right.
thought they'd have their own personal training gym at some
Right.
point growing up. Everybody just thought that growing up,
Right. You spend a lot of time there. You're like, yeah, it'd be cool to have one of these.
I want one of these for myself.
Right? Yeah, why not?
So true. It's so true. How was
Right.
that? A question for you. Seeing your dad being a business owner,
Mhm.
like how did that, you said that really, you like that a lot. But that could be pretty scary at the same time. I mean,
Oh,
it had to
100%.
yeah. I mean, what made you choose to go off on your own opposed to working for somebody?
Yeah, right. Great question. A lot of it has to do with personality and not wanting to be told what to do anymore.
Yeah, Beth
So
tries
you're
to
in-
tell me all the time what to do.
Right.
Like that.
I do tell you what to do.
With the name on the
I mean,
wall,
somebody's-
Beth, the name on the wall.
There's got to be somebody there, right?
I got the hot poker. Come on.
Yeah.
Yeah. So when going through school, I was in school till I was 27, 28 years old. And it's just one thing after another being told what to do. And you just can't wait to, I just want to work for myself. I want to do what I want to do in my office and have the decision-making ability to do what I think is right. And I never wanted to be pushed in a direction as a business owner to take advantage of anybody or anything of that. I never wanted to put money prior to what was important for that person or that patient or vice versa. So I was fortunate to have that upbringing and just being taught that from a young age. And I think that's what I just learned from my father, subconsciously, just growing up, going through that, so it was always about the patient first, not about the business or anything of that nature. So.
Yeah, and definitely different. It definitely makes a difference with approach when you work on your own. Because like you said, you can take different avenues and try different things and really dig into it. Because it's not just about quota. Hey, what's this? I need a quota. You know what I mean?
Right.
Quota driven.
And eventually you learn that, I mean, you get into practice and you're like, oh, shit, I got to make money to stay afloat.
Yeah. Like
So
people really like me, but I need to make money here.
Right. Like, I mean, you still got to make smart decisions and
Right.
do the right thing, at the same time. So it's a lot tougher than what you think. At least what I thought growing up and then just getting into practice, I started right out from school, right into my own practice, and day one I opened the doors and I'm like, all right, I'm open, but I'm not ready to see a patient. I'm like, I still got to put intake paperwork together and everything like that. But I was open. I had a phone number,
Yeah.
So,
yeah.
But that was just my story. I am kind of a person where I need to be thrown into it in order to learn it
Mhm.
and really have my back against the wall to figure out how to do it. Otherwise, I sit there, I'm like, yeah, well, as it comes along, we'll figure it out. I'm a little bit more laid back that way than some other people, I imagine. But yeah, that's how I kind of operate the best. I kind of got to be thrown into it and really experience it to feel it out and feel what the best way is for myself.
What year did you open the doors to your business?
It was June of 2008.
Wow.
Yeah. So it's been quite some time, even though it doesn't feel that way when you first start talking to somebody, but then when you start mentioning dates and whatnot and looking back, you're like, yeah, we went through a lot.
Yeah, no doubt. And then that was Zelasko soft tissue and spine, correct?
Right. Yeah. I opened the doors to Zelasko soft tissue and spine. That was my original practice. I was in private practice by myself. Started with no employees whatsoever. I was the guy answering the phone. I set your appointment. Right.
I remember that.
I think it was a good year or so before I was like, all right, I think I can pay somebody to do this. And even then it was a question of, well, we'll give it a shot. Maybe I have to let them go in a month.
Right.
But but it was good. I mean, when people see you start growing and hiring people, it takes off and word spreads a little bit more. But yeah, my original practice was Zelasko soft tissue and spine. I was right in Orchard Park, border of Orchard Park, West Seneca, until August of 2020.
Oh, okay.
Perfect timing, right in the middle of the pandemic. Why not switch offices, start a new practice, right? Things weren't hard enough as it is, you know? And it had a 6-month-old baby at home at the same time.
Oh, congratulations.
So, yeah, appreciate it. So, yeah, that was a little, I mean, we were working on that merger of 2 different practices for about 1.5 years at that point. And it just got delayed because of the pandemic start and everything of that nature and just working things out. But switched over. I merged with another Dr. Adam McCrae, and we formed Prime Spine Associates. And that was just, we were both doing the same type of work 4 miles away from each other. So we're like, well, why don't we at least get in the same office so we can fix each other during the day? And then that way we keep prolonging our careers. And then it's always nice to have another doc, you know, to bounce ideas off of and bounce difficult patient encounters off of and just cases and everything of that nature. So it's been awesome since we've done that.
Yeah, and that has to be a different approach for you too, because opening in 08, being by yourself, and then being with, and you're always questioning, okay, what treatment's the best? How does this look? How can I work this out? And then to have another, you know, person you could bounce that off of to get some ideas and feedback from, it's got to be great.
Yeah, right. Adam and Dr. McCrae's got the same background as me. We both actually went to the University of Buffalo.
Oh, nice.
And both ended up at what's now called Northeast Health Sciences, which was New York Chiropractic College previously. So we graduated maybe a semester apart. He went to Maryland originally, and then when I started here, and then moved back a few years later. And then we were both just kind of growing up in the integrative diagnosis system, studying that, practicing that, and our practices just look very, very similar. So it just made sense being 4 miles away to get together, and then that way we can just grow that same practice. Yeah,
you were the first chiropractor to talk about soft tissue treatment to me.
It was, I remember one of the big reasons I opened, it's funny you mentioned that because I didn't even think of that at first. One of the reasons I opened my practice on my own right out of the gate was my certification as a full body active release technique specialist, or just certified in that technique. I did that while I was in school and continued to do that right as I was getting out of school. And there was nobody within like 25 miles that did that, right? Of park. So I'm like, well, shoot, why? I mean, you got something that everybody else doesn't have. Why not just go for it? You know? So that's what helped me kind of get my foot, my foot on the ground and just kind of build a practice from there. That's really what I based it off of.
Can you explain to people listening what soft tissue work is, or soft tissue technique, right, so they have a better idea?
Yeah. Yeah, right. Because in the world of chiropractic, there's everybody's favorite technique, right? Like it's just, whatever chiropractor you talk to, they got their favorite technique. So the reason soft tissue work became my favorite technique is because I saw the most results with it, right? I experienced it myself. I saw athletes have the best results with it. I went to a weekend seminar the first time and I was like, wow, we actually fixed a few people and fixed those problems, right? And then followed up with those people, back at school a couple weeks later, and it sustained itself. So I'm like, all right, that's a sustainable change. Where sometimes with the regular traditional adjustment, we don't have that sustainable change. It's like, well, we got to adjust it 3 times a week for 3 months, and then it'll finally stick. And I'm like, all right, well, the natural healing time for a musculoskeletal injury is 4 to 6 weeks. How much are we really changing something with the adjustment versus just minimizing pain while the body heals, right? Whereas the soft tissue injury, if it's adhesion, it's sticking something together and it's stopping a range of motion, and you physically break that down and see the change right there. And then 2 weeks later, it's still just as good. You made a change, right? So I couldn't explain it that way back then, just based off of everything I'd learned and just being so early in my career. But I saw those things and I felt those things. So I kind of got off on a tangent there, but back to your question.
No, that's good.
That's
perfect. Let it roll. It's
that's
good.
Perfect. Because anytime I even tell anybody about, where I take Molly, I don't say anymore, oh, this is for chiropractor. Like that word is not even honestly in my brain anymore. It's, I'm taking her to a soft tissue specialist. Like that's what she's doing. And that, because the second, there are some misconceptions. Some people are like, oh, chiropractors. Nope, I will never go to a chiropractor and get adjusted on a table. And you know what? That's fine for some people. But when you actually find what the differences are, and how many different ways that body can be manipulated and repaired for recovery is unbelievable. And I think, like, especially for me to see it for Molly, because she suffered for so long, to finally see her get relief, and it's unbelievable.
And there's a time and a place for the traditional adjustment. Absolutely. It's not as frequent as when I got into practice, I didn't see it as frequently needed as I saw the soft tissue stuff. So I gravitated towards the soft tissue stuff because I saw it working the best. It wasn't just because it was my favorite thing to do. By all means, it is not my favorite thing to do. Like, it took years off my body doing that for the last 14 years. Like, it's a lot of work. And there's times where I'm just like, I don't know if I'm going to make it, So a lot of my time spent was just figuring out how can I continue to provide these kind of treatments and results without destroying myself and having to retire early, But yeah, the soft tissue thing is great. What we're doing is just paying attention to range of motion. Seems pretty simple, right? But if you cannot move through a full range of motion with ease and pain-free, you have something wrong. You're not healthy in that area of your body. So it's just looking at that, identifying it, and then palpation, where we feel with our hands and identify that adhesion, which takes a long time to kind of learn. Which nobody tells you in the beginning. They're just like, yeah, just learn how to do it. And then it's like, all right, well, a year and a half later, you're like, I think I feel it, Nobody told me it was going to take that long to figure out. So yeah, it's just identifying that. And once you can feel it and identify it, then learning how to break it down, which has gotten dramatically easier in the last year and a half due to some technology that's come around. But yeah, it's just, I've seen the biggest changes with it, and I've seen the most sustainable changes with it. And that's why we choose to do it.
And I remember working with you when you would do some of that soft tissue work. I would just naturally feel something be adjusted. I'm like, did that just, and you're like, yeah, you just break up adhesions around there. And I'm like, I was so amazed by that, because sometimes, when people think chiropractic, they think go in, hard adjustment, get out. And when you finally link up with somebody that's like, well, no, you can be here for longer than 10 minutes. I'm like, for real? Like, this is awesome. And then it's like, what are you doing? And it's like, holy cow. It's like a totally different approach. And actually, when you have injuries and then you go to someone like yourself and you realize, oh, wow, they did soft tissue work, I feel better. I don't just feel like the success wasn't based on how loud the adjustment was.
Yeah, right.
Do you know what I'm saying? Where it's like, I actually feel like I'm recovering. You know what I mean?
Did it go or did it not go? Right. Like,
yeah. Yeah.
That anticipation, right?
Yeah. What technology through the years has changed when it comes to finding adhesions and breaking them down? Because that's really interesting.
It's awesome. And it's something that's been around forever. So we've gravitated using specifically radial shockwave therapy. So extracorporeal shockwave therapy. It's a lesser version of lithotripsy that they break down kidney stones with, and it's been around. I've heard about it 10 years ago working with the Bills. When I was working with them, one of the players had it done, but the way in which it was interpreted back then was you had to damage the tissue like crazy and then let the player or the person heal for like 2-3 months in order to get the benefit, because it was mainly being used for tendinopathies, bad degenerated tendons. So this individual had an Achilles tendinosis. It was on the verge of rupturing. He had to do something. He didn't want to have surgery done, so he chose the conservative route. And they just blasted away with what's called shockwave therapy, essentially. And then told him to wear a boot for like 2.5 months, 3 months. And I was like, how are you going to get stronger and prepare for the season if you have to wear a boot for 3 months over the summer?
Yeah.
So it to me, I was like, well, that doesn't make any sense. Even if it does work a little bit, it's not practical. We can't, nobody that comes into my office wants to be told, well, you got to sit out 3 months, even though we're not doing surgery. Right. So I didn't look into it much further there. And then a mentor of mine, just about 1.5 years ago now, almost 2 years ago, he was reading some interesting research on senescence and senescent cells, which are just damaged cells in the body. And, there's about 6 characteristics or so of that. And somebody had brought up shockwave therapy to him, and he's like, you know what, I'm going to read into that and whatnot. It's the middle of the pandemic, so people have plenty of time to sit home and read and just learn more, right? So that's what he's doing. and just happened to come across the shockwave and started reading about it. I was like, wow, 4 out of 6 of the problems with senescent cells are what shockwave fixes, right? So started experiment with it a little bit. We found out that it can break down adhesion if you follow the right principles to do that. It's not easy. We've learned that because we had the machine since last August, and we didn't even really start using them with patients on a regular basis till this spring, just because it's not point and shoot, right? It's just learning how they specifically work, which is why they've been around for 20 years and nobody figured out how to break down adhesion with them, right? It's just a very nuanced way of going about it.
Mm-hmm.
But the nice thing is the technology makes it a lot easier to break down adhesion if you learn how to apply it properly, and going from there, and it saves your hands a ton. So I'm not having to do as much with my hands right now. And again, we're still improving on it all the time, just like we were always improving on how much we used our hands and our technique doing that, breaking down adhesion as well.
How long is the session when you're using the radio shockwave therapy?
We're still at about 10 minutes because we're still right around that 10-minute time frame. And it's because we're being super picky, picking out one thing, making sure we're making a change with that. And the thing is, the shockwave's so thorough, it makes it so much easier to treat more. One of the biggest things we've had to be careful with is just the dose of treatment. Like we can't over-treat, right? If we over-treat, that's when I'd have to say, okay, don't do anything for 2 weeks. It's the middle of the summer. Like people want to go golfing today. You know, it's nobody even wants to take 48 hours off, you know?
Mm-hmm.
So it's controlling that dose, making sure that we don't set somebody up to go out and injure themselves further, because that's the opposite of what they're trying to accomplish. So
with taking such a conservative approach with that, if you were to be more aggressive, would it be more beneficial? And are you not taking such an aggressive approach because people want to go do things, or does it not really matter? It's
hard to say. It's so hard. Great question, right? It's so hard to take someone out of their daily routine.
Mm-hmm.
And knowing, right?
Yeah.
Knowing how much of that dose can you apply. Like for instance, today I worked with a dentist and treating her neck because she's looking down over a patient all day long, right? It gets beat up. Okay.
Mm-hmm.
She has to go back and work 8 hours straight tomorrow.
Gotcha. I see what you're saying.
We have to limit that a little bit. So in a perfect world, yes, if we could control the work situations and just the daily activities, we could do more. But what we find is it's just so hard to control those things.
Absolutely.
And even we work on each other and we still mess it up, right? Like we still do something and then, well, I had to clean the basement, or I had to go do something outside, and it's like, I flared it up. We got to wait another week to treat it again, So it's a difficult thing. Like I see it from both sides. It's very hard. So that's what we're trying to figure out.
Yeah, that's really interesting how far everything has progressed through the years as far as treatment and other ways you can treat it outside of just hands-on.
Right.
It's really wild.
Yeah. Yep.
Right. What are some of the myths and misconceptions people have about chiropractic care that you hear that you'd like to clear up, I should say?
Yeah, right. Not all chiropractors adjust. And not everybody lays you down and just cracks your neck, cracks your back, and you're out the door. And I'm not saying there's anything wrong with that. There's a place for it. People enjoy. There's a good population of people that enjoy that and just feel better that way, right? And it is a pain management strategy. It does minimize pain. It does get a joint moving for a period of time. So there's a place and a time for that. But it's not the only thing we can do. We have a lot of other ways of manipulating the body in order to get sustained progress. But the biggest thing is you go once and you have to go the rest of your life. That's partially true, right? Because you go once to the dentist and they don't tell you not to come back again,
Right.
They don't say you're going to lose your baby teeth, so don't worry about it. You don't have to brush your teeth. Your adult teeth.
Right.
So part of that is, you go to your primary doctor, and yes, you got to go back once a year the rest of your life. That it's just, if you look at it from that viewpoint, it makes sense, right? But there's a bad rap and it the profession's partially to blame, right? Because too many doctors have been like, no, you just got to get adjusted once a week for the rest of your life to feel good. And that's just because they got blinders on and they're just doing the adjustment. They're not looking at the big picture, right? So it's a misconception. It's not true, but it's hard to find someone who will not do that in the profession as well, especially if they're only relying on the traditional adjustment, put it that way.
Yeah, and it also becomes a part of your recovery routine as well. So when you say, you should be coming back, you should be getting these treatments, especially if you're an athlete or you're just in general. I mean, if you have aches and issues, it's something you want to keep up, and it's kind of like preventative.
Correct.
Instead of trying to deal with that issue once it's flared up and giving you problems.
Correct. Yep. A big, maybe not a misconception, but something that for anybody out there that's wondering, like, well, how do I identify if someone's doing the right thing for me, is, do they take measurements? Do they measure your range of motion? Do they like reliably look at something and say, okay, that's not normal? We have a baseline of what is normal, and you're not in it right now. Okay. And then over a few treatments, does it get you to normal, get you closer to that? And that's the way you can tell, are you making sustainable change, or are you just going and getting treatment and be like, well, how do you feel? Just, that's the only question to measure anything. So that's one way to kind of weed out who's going to get you better, who's not going to get you better, and who's just going to make you feel good for the time being while they're in their office.
Yeah, it's similar to working out, where it's like, it doesn't mean you had a great chiropractic session just because the adjustment was really loud. Just like it doesn't mean you had a great personal training session because you can't walk the next day. I don't know if that was great. We may have overdid it a little bit. Like, it's like we may have.
You want to make it home.
Yeah. You want them to come back again. You know what I mean?
Yeah.
Right. And you guys are the same thing in your profession. Like, the people that do really well and get good results track everything, right? Or at least track a substantial amount of measurements and numbers to make sure you're making progress. Otherwise,
you don't know.
You show up 3 months down the road and you're like, well, did you lose any weight? No, I don't think so. Or, do you look any different in the mirror? I don't know. Maybe.
Yeah. Data. We love data.
We say the more data, the better. It's almost, what it is though? I think in our profession anyway, it went from like screaming at people was like the typical definition of a trainer to like when Beth and I at least talk to people, like, all right, I want you to write down what you ate. How you feeling today? Where's your stress level? Did you poop today? Did you get enough recovery? They're like, why aren't you yelling at me? It's like, because I'm not going to scream the poop out of you. Did you use the bathroom or not? Like, I'm trying to see if you're feeling okay. Like, you know what I mean? It's
right.
The details we need.
Yeah, I said no TMI with my clients, man. Tell me everything.
Absolutely.
Bryce, so we know you do the soft tissue, the radio shockwave therapy as well, the soft tissue work. What other services do you guys offer, and can you explain the benefits of each and explain the service itself?
Yeah, we don't do a whole lot more than that, believe it or not. It's just from the start to the finish, we just take a complete and thorough history. The diagnosis is the big thing. We always skip over that. Everybody wants to know what's wrong. Having a real good understanding of as much as we can from day one, what's wrong and what's causing the pain, is the big step that nobody really talks about, because it's nerd, right? Like, you got to nerd out in order to get to that.
Love to nerd out.
Yeah. Like, and we like to do that. You know what I mean? But nobody else wants to hear about, So everybody wants to hear about, well, what are you going to do? It's like, well, I don't know yet. I don't know what's wrong with you.
Right.
You can't skip over that part, and that's super important. So establishing that accurate diagnosis the best you can, at least from day one, and knowing what you're going after, and then unloading that, improve range of motion around that using either our hands or the shockwave therapy. And then balancing strength is the next step, which is 1 or 2 at-home exercises. We don't go crazy on that because that's not our profession. That's not what we're there to do. That's not the best use of our time. We get you on what you need in order to be stable. And then if you want to thrive or get stronger outside of that to do other extracurricular activities besides just regular activities of daily living, then it's your responsibility to get a hold of some guys like you, physical therapists, something of that, to take you that extra step of the way, right? Because after you balance the strength and you're healthy and you can do regular stuff throughout the day, then it's all about increasing strength, right? And staying flexible at that point. And that's where your guys' realm is. So yeah, as far as techniques or services and stuff like that, we got a bunch listed on the website, because every time we changed or learned something new, we didn't take the old stuff down. We just left it there so that people could see how we came around and what we've done in the past versus what we're doing now, and why we're no longer doing that. We have a reason why we don't do just as much as what we don't do versus what we actually do.
What's something that you guys don't do as much?
The traditional adjustment, right?
I'd say that I was going to say traditional adjustments.
And by definition, we don't do active release techniques anymore. It's that technique became outdated when integrative diagnosis was formed back in 2009, 2008, 2009. I was fortunate enough that integrative diagnosis was formed around the time I got into practice, because I was in the practice for about a year and a half, just adjusting everybody like any other chiropractor and doing ART is what active release is. And just kind of going to town, sweating my butt off, like treating a million things on everybody and wondering why these two people that have the same thing going on, why did that one get better and this one didn't, right? I treated the same on both of them and they got better and they didn't. Why did that happen, right? And that's when I started looking for more education and more ways of learning. And that's when I found ID or integrative diagnosis to help me kind of go along the way from there. And that's what we've been studying the last 12 years or so. So
that's so cool. I could nerd out all day about this because it is so cool. Right. So at your practice, is there any certain type of clientele you guys work with? If you work with everybody as far as like athletes, everyday population, age, things like that?
Almost everybody. I would say over the age, and we're seeing it younger now than when I first got into practice. When I first got into practice, if I saw somebody under the age of 18, it was pretty rare. For mainly the reason that adhesion doesn't accumulate to the point of causing a problem under that age, right? Like you're still adding tissue, you're still growing, you're still just maturing. So any adhesion that builds up just from repetitive motion doesn't accumulate to the point of causing a problem that we would need to fix. So it was unusual to see that. Now, I don't know if it's just metabolic issues. Like we can get into a whole different topic here, right? Food.
Love it.
Food,
Let's
plastic.
that one.
Well,
Everything
do you think
that we ingest and all the toxins and phthalates and all that stuff, like, is that just metabolically killing us right now? And that's why we're seeing this? Because I got 12-year-old walking in with adhesion that's actually causing pain. And I'm just like, why is this happening? It's not just because the person does Ninja Warrior on the weekend, you know, like he's 12 years old. We used to do that in the backyard. We just didn't call it Ninja Warrior.
No,
you know?
we just called it monkey bars.
Right.
So
we didn't stop and take a break and only do it once a week. We were out there every day, you know? So we're definitely seeing changes over the decades, just overall health. And it's got, I mean, the only thing you can look at is food and toxins and stuff of that nature. You know, that's changed quite a bit. We get takeout more than we ever have, you know? So yeah, anybody over the age of 18 is typically the patient base that we see. And it could be anybody from an athlete to recreational athlete to the assembly line worker to the person who sits here on a, you know, computer all day long, or a banker that sits at the desk all day long. So every single profession and recreational, you know, activity has its repetitive motion and has its postures that you do. And once you stop growing 18, 20 years old, you pick your favorite things that you want to do and you do them every week, right? Or you pick your thing that you hate the most and you do it for work every week, right? So it's just, you're doing the same thing repeatedly every week. So it's a lot of repetition, and that's what starts to accumulate that adhesion.
I was gonna say, so that's pretty much what it is. I was going to ask, like the thing that accumulates adhesion is just repetitive motion.
Yeah, it's repetitive motion. Any muscle contraction limits the amount of oxygen in the tissue, and in a state of hypoxia, the body naturally produces adhesion. Some people genetically produce it more frequently than others. You know, some people are just genetically gifted and don't have that problem as often as others do. Some people have better blood supply to tissues and they just don't get a lack of oxygen in the tissue, so they don't produce it as much. Other people just eat healthier and take better care of themselves as well, right? Like that happens too. So
now I was going to ask too, with the younger athletes, well, the younger people that you're seeing under 12, are they athletes? I mean, I don't want you to give out too much info, but I don't know if you notice a trend of like, well, because when we were younger,
all day long.
well, because I feel like the emphasis on specialized training at a younger age is at much higher than it was when we were young.
Yeah.
So the repetitive motion of a pitcher, let's say, might be much higher nowadays for like 7, 8, 9, 10, 11, 12-year-olds than it would be, you know what I mean? I didn't know if that had something to do with it, and that's why you're seeing the younger pop.
I have a feeling it does. Again, I'm just getting into this. I have a 2-year-old, so we're not quite into anything organized yet.
You haven't started pitching yet?
It'll get here eventually, I'm sure.
Just tape a little 3-pound weight on his hand.
Right. But yeah, the organized sports, I think kids play, instead of playing 3 sports, 4 sports, a different sport every season. I think we get stuck in specialization, like you said, a little more often. And that leads to more repetition. They don't change their activity every season. Now, they're still kids. They still change it up, but it's definitely different than, say, 30 years ago from what I remember, so.
Yeah, that's what I was wondering, because I do feel like it's such a young age now. There's even for camps for kids at such a young age, but it's like not just like a football camp, it's quarterback camp.
Yeah.
And it's for 7 and 8 year olds.
yeah.
And you're like, holy cow. It's really
Yeah,
wild.
there's people that play on 3 travel teams in the same season. It's 3 different sports. It's not the same sport. Like, I grew up playing baseball. I'm not going to deny it. I played 3 different teams all summer long, right? We were playing ball every single day of the week. And sometimes doubleheader Saturday and Sunday, which my shoulder did not appreciate. But at the same time, kids are still doing that now. And what we're seeing more is they're playing 2 different sports at the same time, or 3 different sports at the same time, because travel hockey goes all year round. And then travel baseball goes half a year round. Sometimes now they play indoors, through the winter. So it's a lot of that overlapping that you're seeing. And I'm just, somebody comes in with a 15-year-old and it's like, they just need to pick one thing and roll with it. And for this
is
season,
a whole nother podcast. Like, this can go really deep. Like, this is going to be a good one to talk about.
Yeah. And it's just, you could go off on that tangent all day, but it's just, sometimes kids just need rest. They just need to change it up, and that's typically what happens when someone younger comes in, unless they're a competitive. The ones we see that are legit injuries and stuff of that nature is the competitive nature of dancing, gymnastics. Don't see a lot of figure skaters, but they kind of fit in that same realm. But those are the kids that do a ton of repetition at a young age. And that's always been that way. Those activities are always, you stay in that activity, right? If you're a gymnast, you do gymnastics all year. If you dance all year long, right? The other sports, kids usually switch up with the seasons and whatnot.
Well, it's such a plus then to have someone like you, because if you are young, your tissue's growing, maturing, major repetition at a young age. One thing we didn't have back in the day was the recovery approach that you have. You know what I mean? The soft tissue work.
And we have a ton of recovery options now too, that don't even have to do with me and just at home stuff,
Right.
There's just a lot more knowledge on recovery, which we need. So
a lot more emphasis too, because
right.
Recovery plays such a huge role. And I think that's something even when it comes to weight loss, when you talk to somebody and you're asking them, how much sleep are you getting at night? And they're like, I don't really sleep. Should we cut my calories? I'm like, no, let's get you to sleep. You know what I mean? Like, it's, we don't put enough emphasis on that recovery, because I think we come from a society, and this is a whole other podcast, but I think we're in a society where we're such like, go, 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 go. I got 4 hours of sleep, 2 cups of coffee. I'm back at work. And I'm like, what? Like, I don't think that's what your body needs right now.
Right. Or even the importance of your rest days.
Yeah.
Right. It's immediate gratification. That's what we've been taught, right? Since
the
day of cell phone and the day of social media was born, it was things went down.
I just take my Instagram pics and I come right back in the house, like in my gym. So there's no workout that took place at all. It's a nice little quote and I'm back in the house. Little filters, I'm good.
You figured it out.
That dude's always working out. Haven't worked out in 2 weeks. No, but you are right. It's tough. You take pride in like overworking yourself when the thing your body really wants is to rest and recover.
And I
think a lot of people. Go ahead, Ryan.
I think one big thing now is just there's a lot of push to kill your workout or just go 120% through your workout. And we were taught that playing sports as kids, but now it's every single person over the age of 25 that wants to lose a little bit of weight because they were sitting behind a desk now is told to just destroy themselves on every workout. And I'm just like, that's not healthy.
Yeah.
Right.
And I did it. Like, trust me, I did
we all
it.
Did it, dude.
Like,
we all did it.
I'm learning from it,
I think there's a lot of people too that think that the recovery is only for people that quote work out hard or play sports. This recovery and repair conversation is for everyone, especially as we age. And we talked about how people are more sedentary at this point in time. We're either you're either not using your muscles enough or you're overworking your muscles. And there's just this fine line for everyone to really figure out how important your recovery is. And everyone should be incorporating some sort of recovery, repairing, maintenance of their body.
Right. And I think the big thing that Brian touched on a second ago is sleep, right? Like if you're not sleeping, you're not healing. And all of the devices and everything we do all day long that we never look away from interrupt our sleep on top of it. So if you're doing that at the end of the day, you're taken away from your recovery on top of it, right?
Yes.
And we used to get yelled at as a kid not to watch the TV for too long. And now the TV's like a break compared to everything else that we could be doing.
Yeah.
Right. Brian, when post-COVID, did you notice an uptick in clients with like specific injuries? Did you notice like a trend of injuries or issues that people were dealing with?
What we did notice in my practice was an increase in neck and back pain, because everybody that needed to work from home had a terrible setup, right?
Yes.
They weren't leaving their house anymore. We were told we couldn't leave our house. We were going to get sick if we walked out the door. We had everything delivered to us. We weren't getting out there. It was snowing in the first week of May that year. So it was like just depression, like no tomorrow, right? And, but yeah, we had a very big increase in neck and back pain just from people sitting in bad postures, working on the computers, working on their laptop because they didn't have access to the desktop that they use at work, So we did see an uptick in that, which lasted maybe through the fall of 2020, when people just realized they're like, I might not go back to the office. Like we might just have to set this up, and people got better setups. And we, talked about that obviously as it was going through, as we figured out that that's what was starting to increase that.
Yeah, I noticed that too, from switching from being in a gym all day to working from home primarily. I'm like, man, why do my hip and back are bothering me so much? It's like, right. Have you moved today? No, I've been sleeping for 14 hours. I took that one gym selfie, but outside of that, right back in the chair, I'm good to go.
Right. Yeah, it was a big transition for everybody, no doubt about
it. So, Brian, do you have a specific location if people wanted to come find it?
Yeah, our office, Prime Spine Associates, located on Transit Road, just north of the 400.
Oh,
it's actually Elma, New York, even though it's right across the street from West Seneca. So we're on the border of West Seneca and Elma. Transit Commons is the name of the complex that we're in. We have an office in their buildings.
Awesome. And can you give people your, so how to reach you, social media, email, website, all that stuff?
Yeah. Website's prime-spine.com. And you can reach us through the website. You can actually email us through the website. That goes straight to the front desk. We'll get that, no problem. Phone numbers on there. You can even request an appointment through the website. Through Facebook, kind of goes unmonitored a little bit, but I have my own page as well as the business page, and we can check in on that. I would say roughly once a month we get on there to check in on that. Not real good about that. I try to get away from it, but it's just time consuming. So
yeah. Yeah. Awesome, man. Well, I really appreciate you coming on today, and we would absolutely love to have you on again to dig more into some of the topics we talked about.
For sure.
But I will attach all your social media information to the YouTube video that we'll upload. I'll grab that from you or Beth, just so people can get a hold of you a little easier once they're listening to the podcast. But thanks again so much for joining us today, Brian. We really, really appreciate it. It was an awesome, informative podcast.
Yes.
Thanks
Hidden gem, everybody.
It was great to be on. I appreciate what you guys are doing. I think you guys are doing great.
Really, really appreciate it, man. It was great catching up with you as well. So
same here.
For myself and Beth, we would like to thank you guys, and Brian, we'd like to thank you guys for joining in, and we will catch you guys next podcast.
Bye.